Good morning, everyone, and welcome to Shoppers Drug Mart. My name is Tammy Smitham. I am the Vice President of External Communication for Loblaw Companies Limited, and Shoppers Drug Mart is a division of Loblaw. I will serve as your MC for today's event. I want to thank Associate Owner Alex Hone and his pharmacy team for hosting us in his store today. We're very pleased to be a part of today's event in support of helping provide Ontarians with access to Naloxone in an effort to reduce deaths from overdose in our province. Just to give you an understanding of today's agenda, we'll have official remarks followed by a demonstration of a naloxone injection as well as an intranasal naloxone administration, followed by a short demonstration of the website and a short Q&A as well. I would like to now welcome the Honourable Eric Hoskins, the Ontario Minister of Health and Long-Term Care, to the podium to say a few words.
Thanks, Tammy. Well, good morning, everyone. I appreciate your patience and for being here. This is such an important topic, and I appreciate the great efforts that you have been making, and hopefully will be continuing to make to spread awareness and education as well about the opioid crisis and what we're doing about it. And I want to start as well by thanking the whole team at Shoppers Drug Mart, but particularly Alex Hone, who is the local pharmacist and hosting us here today. And I know that, I hope we're not disrupting things too much by being here, because I know that the team of pharmacists here, as in all pharmacies across the province, work around the clock, helping a diverse group of individuals and patients like the ones that avail themselves of this pharmacy. And they have a whole range of healthcare needs. So I appreciate the time that everyone is taking out to join us for this announcement. I think particularly pharmacists know that I have always been an advocate for allowing pharmacists to provide as much care as possible to their patients because of the unique relationship that they have with their communities. Pharmacists are often the healthcare providers patients and Ontarians see the most because they're just down the street. They've got flexible hours and there's no appointment needed. And today I want to talk about the role that they, as well as other community health workers, are taking on as opioid overdoses are becoming more and more common. As you all know, we've seen a rise in the number of overdoses from street drugs that have been laced with opioids like fentanyl. Fentanyl, which is 100 times more potent than morphine. And quite often, those using street drugs, such as cocaine, that have been laced with opioids, have no idea until it's too late. Last fall, I announced that our government was taking action through our first ever comprehensive strategy to prevent opioid addiction and overdose. And as part of that strategy, our government expanded access to Naloxone, free of charge for patients and their friends and their families. So through pharmacies and other organizations across the province, including public health units and community health centers and needle exchange programs, Naloxone is available free of charge, not only to those who perhaps may find themselves in that situation of overdose or threatened overdose themselves, but those around them then that can immediately and quite dramatically save a life. Naloxone is an incredibly valuable tool in the fight against opioid overdoses. As most of you here today know, it's a drug that can temporarily reverse an opioid overdose. And with the help of pharmacists, as well as other important community health workers across Ontario, Naloxone is helping to save lives. In fact, those of you, some of you in the media might have seen in the Brantford Expositor, I think perhaps the Hamilton Spectator, that just yesterday, an individual at Brantford General Hospital was brought in, vital signs absent, brought in by a friend and this individual had overdosed, and naloxone was administered, and that individual's life was saved. So it is a poignant and I think very vivid reminder of just how impactful having naloxone available for those circumstances can be. So today I'm pleased to announce that since the end of March, we now have over 1,000 pharmacies in more than 200 communities across the province that are making naloxone kits available free of charge. And so far, since last summer, we've distributed across the province, with the help of our pharmacies, our public health units, and community partners, more than 28,000 naloxone kits. And more pharmacies are continuing to come on board. So I want everyone in Ontario to know that naloxone is a life-saving drug that can reverse the effects of opioid overdose. They're available free of charge at pharmacies, no prescription needed. All you need is your OHIP card. And the kits are easy to use. In fact, pharmacists will train you on how to use the kit. And to drive that point home, Marie-France and I, in a few minutes, are going to do a demonstration of exactly how naloxone works and what you need to do when someone has an overdose. And for those who want to stick around a little longer, we'll also be demonstrating just how easy it is to find out where naloxone kits are available closest to you through Ontario's new online tool. I also want to thank members of the media for doing your part in bringing this issue to the public's attention. A major barrier to stopping opioid overdoses is awareness, and the media has done a tremendous job in this area. And you've done so in a way that is respectful and non-judgmental. Opioid overdoses are a serious and avoidable issue our society is grappling with. It's the third leading cause of accidental death in this province. So getting naloxone kits into the hands of the people who need them is vitally important. I also want to make it clear that our government recognizes that harm reduction alone is not going to solve this crisis. We're committed to addressing the problem of opioid addiction and overdoses from all angles. And in fact, our government has made significant progress since we first announced Ontario's comprehensive opioid strategy last fall. We're focusing on appropriate prescribing by healthcare providers like doctors and nurse practitioners. We're focusing on developing standards of practice with Health Quality Ontario. We've invested or are investing $17 million additional dollars in pain clinics associated with hospitals around the province, 17 pain clinics. And of course, we're also making sure that we're providing adequate mental health supports to individuals who perhaps may be at risk of addiction or are finding themselves addicted to opioids or other narcotics. So Marie-France is going to go into more detail about the work that her ministry has done in the community safety and correctional services sector. And of course, our government, all of us, we're continuing to work with our partners, including those with lived experience across the province, to build on the important work underway. So I want to thank everyone who's been part of this important work, whether you're a pharmacist, whether you're someone working with a community needle exchange program, or simply a friend who picked up a naloxone kit for your roommate. Your actions are saving lives. Thank you.
Thank you. I'd like to now introduce the Honourable Marie-France Lalonde, Ontario Minister of Community Safety and Correctional Services and Minister for Francophone Affairs, to the podium to say a few words as well.
Merci beaucoup, Tammy. Thank you, Tammy, and good morning. Bon matin à vous tous. I want to say also, Alex, thank you very much, and all the staff here to welcoming us this morning. This is great news. I'm very pleased to be here to tell you about the steps that we are taking in Ontario's correctional system to address opioid addiction and overdose. Many inmates in our correctional system have complex medical and behavioral factors, including substance abuse and addictions. When admitted into our care, inmates who are identified as having substance abuse issues, including opioid addiction, have access to needed healthcare supports. And I want to take a moment to thank our correctional officers and the healthcare staff in our institutions for their hard work and dedication. J'aimerais prendre une minute pour remercier le personnel de nos institutions pour le travail exceptionnel qu'ils font jour après jour. My ministry partners with a variety of social service agencies to provide inmates with addictions program and services while they are in custody, and to assist them to access supports when they are discharged. It is specifically when they leave our care that inmates are at risk of relapse. We are taking steps to help keep them safe and to get them the help they need. As you may know, our government is reforming correctional services in Ontario. We are building a stronger, safer, and more responsive correctional services, looking at every facet of the system. As part of this work, we are consulting with correctional staff and stakeholders, and we are ensuring that inmates have access to better frontline health services. This will help them reintegrate successfully back into the community. A lot of that work is already evidenced across the correctional system. Our goal is to ensure that anyone who enters a correctional facility will have access to a standardized set of core services, including more services to address mental health and well-being. Part of that works include helping inmates with addictions issue. Working with the Ministry of Health and Long-Term Care, we have begun giving Naloxone nasal spray kits to at-risk inmates at the time of their release from our correctional facilities. Kits are being distributed at 10 of our institutions, and we're working with the Ministry of Health to ensure each of our institutions have these kits as soon as possible, and we will have them available at all 26 institutions later this spring. In the meantime, all inmates released from our correctional facilities receive information about how to prevent an opioid overdose and how to access free naloxone in their community. The kits we hand out are easy to use, and they save lives. They are so easy to use that, in fact, as Eric has mentioned, we will be demonstrating how to administer naloxone shortly. Thank you. Merci.
Thank you, Minister Lalonde. Now I would like to welcome the Chief Coroner for Ontario, Dr. Dirk Heyer, to say a few words as well.
Well, thank you very much, and thanks, ministers, for providing this opportunity. What I bring is the perspective from the death investigation system. And as you've heard, touched on by the ministers, I see the tragic outcome in our office in the death investigation system of opioids. We have seen over a number of years a significant number of deaths occur, and we continue to see the numbers to continue to increase, albeit slowly, not to the extent that's observed in BC, and hopefully all of our work together is going to stem that potential rise that occurred in BC. I also want to highlight a little bit more or carry a little further in what Minister Hoskins said, that this is a significant cause of accidental death. It's also important to remember that many life years are lost because there are many young people who die. So in fact, this is not only a significant cause of death, but also a significant cause of death in the younger population. So we see a lot of potential lost through the use of these medications. I also wanted to take the opportunity to highlight some of the work that we are doing at the Office of the Chief Coroner, Ontario Forensic Pathology Service, with the Ministry of Health and Long-Term Care. The Provincial Overdose Coordinator, Dr. David Williams, who's the Chief Medical Officer of Health, and I are working closely with others to develop a strategy to fully understand the extent of this problem and what's occurring across our province. We've been working very closely for the past number of months, and hopefully we'll have much more robust and much more timely data to really understand what's occurring in the province. And that will be not only to help address and to put focus on what's happening now, but also importantly to inform and to give an idea and a perspective on what to do in the future to continue to prevent this serious problem. So I thank you all. We'll be taking some questions, but I'm excited to watch the demonstration of my colleagues. Not on me.
Pressure's on, yeah.
No, not you. We won't do that.
Thank you. Now I would like to ask our pharmacist owner, Alex Hone, to come to the podium and say a few words as well.
Good morning, everyone. Thank you for choosing to hold this important event at my pharmacy today. I'm excited to have this opportunity to talk to you about the work that pharmacists do. We are medication experts that are in every community. I know that a lot of my patients come to me and my colleagues for medication advice because we're just down the street from them, we're always here, and because you don't have to make an appointment with us. For people who may be at risk of addiction or overdose, pharmacists are also in an especially unique position to help. My pharmacy dispenses methadone, so I have specific training which goes beyond just the dispensing of this medication. I work collaboratively with the patient and their healthcare providers to build that trusting and respectful relationship with the patient. Given our professional training, easy access for the community, and our commitment to our patients' health and confidentiality, pharmacists are well positioned to provide naloxone kits to our patients as well as the appropriate counseling. I know that at this location we dispense over 30 naloxone kits. We are hearing about overdoses in our community, and it is heartbreaking to know that these deaths could have been avoided. As more people are becoming aware, more people are coming in for these kits. We're all making sure that everyone who's asking for a kit will have one and will also know how to use them. Thank you.
So now we'll move on to the demonstration portion. We're going to invite Minister Hoskins and Minister Lalonde to do the demonstration.
All right.
Oh, you're taking your jackets.
All right. Okay, I'm going to go first. So, so this is the injectable naloxone kit, identical to the one that you would receive from Alex, who you come in here to request one. And Alex provides the expert training as well to the individual. And actually, I think gives them a piece of paper which indicates that they've received the necessary training. Contains 2 doses because occasionally, well, quite often, 1 dose may not be sufficient. And so it comes in an ampule. It also comes with gloves. I'm not going to put the gloves on, but it comes with gloves as well. And an alcohol swab, 2 alcohol swabs. And the vial looks just like this. So the first thing.
You hold it up and see.
Yeah. So the most important thing, actually, even before you get to naloxone, so say you've come across a roommate or a friend or a colleague, a family member you believe or suspect has overdosed, you look for the clinical signs and symptoms. And I'm not sure if this fellow has a name or not. He's probably not, well, he's typical in the sense that he's unresponsive. So you might come across an individual who is either completely unresponsive or barely responsive. You might see, if you look at their eyes, if their eyes are open, that they've got very tiny pupils. You might find that their breathing is very shallow. And so if you come across an individual in this condition, that you have a reasonable suspicion that they might have overdosed on opioids, the first thing you do before you even think of naloxone is you call 911, or you have somebody with you that calls 911, and then you get to work with the kit that you have in your possession. So as I mentioned, this is the injectable form. So and I'm not doing a sterile technique here just because I'm demonstrating the different parts of how it works. So as I mentioned, you have 2 syringes. So you take the vial, you give it a couple of knocks to make sure there's no fluid in the top of it. And it comes even with this interesting gizmo that allows you to break off the top of the vial quite safely. See? And so once you've done that, you take the syringe. It's got a needle which is about 1 inch long, and you're going to want to drive that needle into the deltoid, either into the upper shoulder, which is where I'm going to go, or the upper thigh, either one, depending on preference or what might be easier to access. So you're going to want to draw out all of the contents that are in the vial. And you're going to get some air in there as well, but it's important to make sure you get all of the contents out. Once you've done that, you put the vial aside, give the syringe a couple of knocks, get the air out, right? So you saw I did it until a couple of drops came out at the top. And then you've got an alcohol swab. So you're going to want to do this quickly. So I'm going slow, obviously, just to show you the different parts. But once you've been trained, you're going to be able to do this very quickly and very well. So in an emergency, right, it's more important to get the naloxone in quick than it is to worry about all of these features, like getting the air out and the alcohol swab, for example. Because obviously this person, the faster you can get the naloxone in, the better. And I'm going to pause before I put it in if you guys can do it visual or not. And I should mention as well, for the injectable, this is the best position to, if the individual isn't already in what's known as a recovery, more or less, a recovery position on their side, you want to put them in a recovery position on their side because it just makes injecting easier, and it's also important in terms of the condition that they're in. But that gives you easy access to the deltoid muscle. And then for the inhaled, you're going to find that the best position is actually to have the individual on their back, because a lot of it has to do with access as well. And then you simply, if you're ready to go, you've got the naloxone, and you simply put it exactly where you're supposed to. Right? So you just drive it right down to the end of the syringe, you push it in. When you push it in, it automatically, as you pull it out, the needle automatically, quickly, it comes out, and you're done. And so, in most cases, if you've done it, if the individual is still breathing, you'll see a dramatic recovery, because what it does is it reverses, on a temporary basis, but it reverses the effects of the opioid on the individual. So you give that a little bit of time to work, and if you don't see any response, then you should go ahead with the second syringe as well. And if you still don't see any response, you should then begin CPR on the patient. And remember, at the same time, you or your friend has called 911, so you anticipate that you're going to have emergency responders on the scene very, very soon. So that's it.
How long should it take to see a reaction?
Alex?
Probably typically they just see some response within 5 to 10 minutes.
Cleaned up my mess. Marie-France to
Oh, well. So this is the non-trained medical person. We're going to put him on his back. Yeah.
Do you have a cable on that mic? Put that microphone right at the table so we go.
So this is the nasal spray that our inmates have access within our institutions and as they leave. Basically, it's pretty explanatory as to how to use it. Each little box has 2 little pouch, which I will open. Try to do as great as you did, Eric. But what's important is, so there is 2 inside. And it's quite easy in terms of to use. So as this individual would be unresponsive, you would open the pouch. That's where Alex and Eric and I'm just going to look at what I do, make sure I do it right. But I think the importance is how easy. So I was very surprised when I saw this, because the actual medication, it's contained in this little thing, so you don't have to do anything. It's already pre-packed the right way. Once I realized that this person is unresponsive, I would tip his head. I will do my very best to tip his head. And what's important is you would use a naloxone, put it all the way in, and just push inside, and it's automatically discharged into the cavity of the nasal of this person. And if I see 5 minutes, would I wait 5 minutes again? If I see it's still unresponsive, there is the other pouch that I could use, and then potentially CPR. But in the meantime, I would have called also 911 to make sure that I have our first responders coming to assist us. Thank you. This is easy. A lot easier than yours.
And then we're moving on to this, right?
The website, yes.
Okay, so then the last demonstration I think we're doing is, and I'm not sure who's, okay, so we're going to show you in fact, it's already up there. Ontario.ca, /opioid overdose. Is that correct? Yeah. So this is a Government of Ontario Ministry of Health website that allows you very simply, we hope, to find the pharmacy closest to you if you want to get a Naloxone kit. So you just click on find a location near you. How I do it? I'm gonna do it. Okay. Yeah, good. And then I probably should have done this in advance, right? So to locate pharmacy. Hang on. Somebody better.
You just click here and you write Shoppers Drug Mart.
Gotcha.
And you click on the search, it'll pop up.
You'll pop up all the shoppers.
Yes.
Yeah. Okay, so doesn't that city come up? Just what's in there.
And if you scroll down, you'll see that.
Yep. This was all the shoppers, in fact, in Ontario.
And the first one is actually in my community.
Is
in
it?
Orleans,
What a
yes.
coincidence. But what if we do, so how do I, let's say you live in Barrie, and I want to show, how would you, who can help me with that?
So just delete this. Just write Barry in here.
I don't know if it's worth doing, it should be doing. No?
It should be, it's not allowing you to drop down.
No,
The drop down menu, is that working?
Try shoppers first and filter it won't. Okay, you can actually organize it by the city. Okay, there we go. So we got all the shoppers in the province, and if you want to know where, and there's an easier way to do this, guys, so I apologize. And I don't know if somebody can walk through it. You know this better, right?
Yes. So you can write shoppers here, and there's a drop down.
Yeah, the drop down is not currently
So that's an
working.
internet connection issue, but there's a list of cities that you can select.
Okay, anyhow, so we're just giving you an idea at least of the shoppers around. If you want to know in Windsor, for example, the Shoppers Drug Mart locations that provide Naloxone, you'll see that there's 2, 4, 6, 7 shoppers in Windsor all providing Naloxone. And I'm sure if we went down here to Toronto, we would find a huge number. And the address of this one is Queen Street, right? So I wonder if we can find the Queen Street one. Not 61 Queen Street East, but it is
524.
524.
Queen Street West.
Okay.
Give another page.
So we probably have to keep going.
Right on the top.
Right on the top, 524 Queen Street West, right on the top is listed. So you can find and you can sort it by a whole bunch of different ways, right? So by the name of the pharmacy, by the address of the pharmacy as well. But I think we must have a connection challenge here, because normally you're able to filter it quite easily by city. Or you can just type in city as well if you just want to know the pharmacies of whatever type in that particular community. All right?
Excellent.
So that is ontario.ca /opioid overdose. And I think
Thank you
that's
so
it.
much. That was excellent. I actually really appreciated seeing that demonstration brought to life, and I know everything moves much more quickly when you're in the moment, but thank you very much. And now Minister Lalonde and Minister Hoskins will be available to take some questions. I'm going to ask Josh to moderate the Q&A. He's back there. Thank you, Josh.
Madame Lalonde,
Dry if it's warm. It's always in front of the lights.
Come with me, just in case. Oui.
peut-être vous expliquer en français qu'est-ce que ça veut dire pour les détenus qui quittent la Suisse.
C'est la nouveauté, si je comprends bien.
Oui, donc, ce que ça veut dire, c'est qu'en ce moment, nous avons 10 institutions qui, lors de leur congé, nos détenus peuvent avoir accès à la médication. Et ce qu'on va faire maintenant, ce qu'on est très fiers de faire, c'est de l'avoir dans nos 26 institutions au printemps de cette année. Donc, tous les détenus qui ont un risque, qui ont été évalués, qui ont été aidés lors de leur insertion avec nous, lors de leur congé, vont pouvoir partir avec un kit. Et ce qui est important, c'est que d'après les recherches, malheureusement, le taux de mortalité de nos détenus lorsqu'ils retournent dans leur communauté ont un très haut risque. Par rapport à 2 à 7 jours, c'est la période qui est le plus risquée pour nos détenus. Donc, nous devons et nous voulons les aider dans l'approche préventive après avoir été encadrés dans nos institutions lorsqu'ils retournent dans leur communauté pour faire certain qu'on peut les aider lorsqu'ils se retrouvent dans les communautés.
Donc, c'est vraiment quand ils sont libérés, là, vous parlez de congé, c'est pas juste s'ils ont un congé, c'est quand ils sont libérés, là, à leur sortie.
À leur sortie. Exactement.
Is there an advantage to the nasal spray seems so much easier than the injection? Is there advantage to one or the over the other, and why have the two?
So they, in terms of their action, they function precisely the same way, so they're equally as effective. The spray hasn't been available in Canada until very recently, just this year, and so the program for making naloxone available in pharmacies, as you know, rolled out last summer, and we're also, I think that for us it was a matter of making sure that we had the available products available to the general public as quickly as possible. There are certain high-risk individuals or high-risk situations where one product might be better in terms of ease of or appropriateness of administration than the other, but.
Someone in the public wouldn't know that. I'm just thinking that
Yeah.
the nasal spray seems so much quicker. Is there an advantage for the direct injection? Does it give you a longer window of recovery for emergency response?
No. So from a functionality perspective, the two are equivalent. So the only difference is just how they're administered. And it may be that over time we'll see change in terms of which product is used under what circumstances. But again, in fact, when we began, and even before, but when we began to make naloxone available free of charge, the nasal spray was not available. It's only recently been made available in Canada. Health Canada looked at it on an expedited basis for use in certain circumstances, but they're both equally effective.
Do we know how many kits have been distributed so far, both nasal and?
So I'm not familiar on the nasal, but I know on the injectable, nearly 30,000 kits have been distributed province-wide through pharmacies, through public health units, through community partners that work with high-risk patients, clients, for example, needle exchange programs, those sorts of partners.
What's the cost for the kits?
I know that they are free of charge to the general public. I'd have to get back to you in terms of the cost to the Ministry of Health for the purchase of each of them, the unit cost.
Since when is the opioid strategy going to be finalized?
Well, so we did announce the province's first ever opioid strategy in the fall. So in that sense, it had about 10 action points associated with it. I referenced a couple of them: the increased funding to pain clinics, the availability of Suboxone, which is similar in function to methadone, but it's much safer to administer, and to appropriate prescribing. January 1st, we eliminated certain ultra high dose opioids as well that were associated with a much greater risk of overdose. So that strategy has been and is being implemented. But I think that we all recognize that this is it's an ongoing process, right? And so as we find new tools or understand new issues associated with what we're finding in our communities, that we will respond accordingly. So an example of that is following a meeting between the Premier and the Mayor of Ottawa. There was an agreement, and I'll be hosting a meeting of municipal leaders this spring to look at how we can more effectively partner and how we can support our municipalities with regards to what they're facing. And I think with the naloxone kits as well, and making that available is an important part of this. So in a sense, I'm not sure if the strategy will ever be finalized, but there are many components of it that are being implemented. But in a sense, I mean, we continue to look for additional measures. I think safe injection services here in Toronto is another example of a further measure that can be taken for harm reduction.
Dr. Hyder mentioned that there was work ongoing on it, however, so when will the next stage be unveiled or announced or be ready?
Well, again, I think the strategy was announced in the fall, and it had many components to it. But as we work with our municipal partners, our community partners, those with lived experience as well, we continue to look for further measures that can be taken. I think a good example is what Dirk, our chief coroner, was expressing with regards to data and surveillance, and working closely with the chief medical officer of health of the province, who's now the province's overdose coordinator. They're working together to improve the surveillance and data management as well. As of April 1st, all of the hospitals in the province are reporting on a weekly basis the suspected opioid overdoses that they see coming through their emergency departments. So that information is now being made available to all public health units and to all hospitals, as well as the Ministry of Health. So again, I think it's we have the first ever province-wide strategy to combat opioid addiction and overdose. But I think, of the belief that it's a strategy that will continue to evolve as we find additional measures that can and should be taken.
Overdose data this story being collected by hospitals as of April 1st be made available to the public? If so, how and when?
So this additional phase that I referenced that began April 1st, we're just, as you can appreciate, receiving the first data coming from that. We want to make sure that it is comprehensive and that it reflects what is being seen. There's an additional stream of data that I think our coroner could speak to that is when there is a suspected case of opioid overdose, well, any death, but if there's an element of or a question with regards to that, if opioids might have contributed to that death, that gets reported to the coroner, and the coroner then makes a decision of whether or not to launch an investigation. And that suspected case then ultimately, under most circumstances, then either becomes a confirmed case of an overdose or not. And so I think that I expect in the very near future that we're going to be in a position where we'll be able to make publicly available a significant and ongoing stream of data that will permit those that are working in this field or have a responsibility, including our municipal leaders and our community partners and others and our healthcare providers, that they'll have, in quite a dynamic way, I think, a greatly improved stream of data, accurate data that will allow them to address this issue even more effectively.
But can we see the improvement on the ground since you launched the strategy, or is it more in the data that we have access to and the tools that are available that we see improvement?
Well, I would hope both, right? So, and some of it's difficult to measure, but I think the example that I gave earlier of the individual that was vital signs absent when they arrived in the ER at Brantford General, who was restored to life with injection of Naloxone. Those kinds of anecdotes, I think, are important, and we're hearing that as well in our communities as a result of nearly 30,000 kits being administered as well. So I think those anecdotes are important. I think what we hear from our community partners who work with individuals facing addictions who may come into contact with opioids, fentanyl, for example, without knowing it. I think hearing from our community partners in terms of if there's a shift to what they're seeing and an improvement is important. But at the end of the day, I think and expect that the data is the most powerful evidence that we will have to demonstrate that, as Dirk has alluded to, that hopefully we'll be able to avoid the dramatic escalation that we've seen in British Columbia. And with the many, many measures that we've put in place, some of them prior to last fall, but certainly since last fall, that we're hoping that all of those steps hopefully will stem the escalation and result in a decline. So I think, and we're going to need to see the data, but I think those anecdotal comments and stories and perspectives from those that are working in the field with individuals with addictions or who come into contact with opioids, I think that those stories and reports are important as well.
What's the most recent available data you have for opioid overdose deaths, and how up to date is your data now, and how up to date will it be in the future?
Yeah, it's a good question and a really tough question, especially in the backdrop of saying how important data is. Unfortunately, our most recent data is 2015. But having said that, we are making significant efforts to completely turn our investigative process for opioid and other drug-related deaths on its head. So we are in the later stages of developing a new investigative approach to these cases that will provide us with robust and timely data, and working together with the Ministry of Health, specifically the Provincial Overdose Coordinator. Our data will be aligned hopefully with the morbidity data, which is the data of illness, as Dr. Hoskins has talked about. Having that information is crucial along with ours, because more often we see people go to the emergency department or get admitted to hospital. The numbers are somewhere between 4 and 10 times the number of deaths that occur. So having both those sources of data are crucial, and will really help us to get better answers to where we're going from a provincial perspective. So I can't give you an exact timeline, but we're in the latter stages of changing our process, and hopefully that will give us much more timely data and be available as well.
When that happens, how timely will it be? Are we talking more than a year delay anymore?
No, it'll be less than a year. It'll be months. I can't give you a timeline right now because we have to roll the process out and we'll see how things occur. But my goal is months, and certainly much less than a year. I can't tell you the number of months right now, but certainly that's the goal.
All right. Thanks, everybody. Appreciate the time.
Just let you know.